Take 2, because you know who has interrupted the first video. I should have a do not disturb sign on my phone. Right, let's talk about my new patient today. He travelled down from Leicestershire on the recommendation of a friend who is a current patient at the Men's Health Clinic. He presents with all the symptoms of low testosterone, and he emailed me the diagnostic workup prior to coming down, and it confirmed a secondary hypogonadism, so a low LH and FSH. He had a low testosterone and a disproportionate high estrogen. So he's got a propensity to aromatization alongside having a secondary hypogonadal picture, which obviously is a potential cause of secondary hypogonadism, because if there's enough estrogen telling the hypothalamus and pituitary not to produce LH and FSH, then it won't. So as a society, we need to reduce aromatization. So clean living, who wants to do that? No booze, who wants to do that? I don't know why I'm doing that. Okay, it's too hot. That's why I'm doing it. I'm a bit wappy. So yeah, he'd come down all the way from Leicestershire, and we had a good chat. Took his history, examined him, discussed the pros and cons, and we didn't decide to start testosterone replacement therapy. Shock horror. He'd come all the way down from Leicestershire and he didn't get TRT. Was he upset? No, he was happy. But he travelled all the way down from Leicestershire to get TRT. Well, this isn't a sales-consumer relationship. This is a doctor-patient relationship. And I'm sure that he was actually relieved, because you are committing to a lifelong therapy. That is quite involved. He was also relieved because he understood that after our discussion, it was not actually in his best interest to start TRT. We didn't shut the door, but we gave him some things to work on, because if he could adjust a few little factors in his lifestyle, he may get normal levels, and that would prevent him from needing TRT. So what aspects of his lifestyle could he address, or should he address, before committing to what is a lifelong therapy? Well, the number one thing was sleep. He had poor sleep. It wasn't a matter of ruminating and not being able to drop off to sleep. It was actually the fact he was a bad snorer, and his wife gave him the old every once in a while and said that she was worried about him because obviously he stopped breathing. So one of the cautions, one of the risk factors for low testosterone is obstructive sleep apnea. So that's when your airway occludes. I've got OSA, it's horrible. It is truly, truly horrible. And CPAP has saved my life. Has it saved my life? Well, it's made my life better, for sure. But yeah, it's a risk factor. It's also a caution whilst you're on testosterone replacement therapy. So it's something that you do need to keep a check on. Most people on TRT, actually, their sleep improves. Obviously not getting the old estrogen, having the hot flushes like the menopausal women. Obstructive sleep apnea. So I've sent him away with the Epworth Sleepiness Scale and advised him to see his doctor, because he should be referred for a sleep study. And if he can improve his sleep quality, that would subsequently improve the production of LH and FSH down to the testicles and increase his testosterone. So super important. We need to remember that sleep is an anabolic process, and those processes predominate when you're resting. So sleep. I'll put a link to the Matthew Walker podcast with Joe Rogan. It's cracking. So if you haven't watched it, it is incredible. And we put it onto the group, and some of the guys goes, I'm going to sleep now. Because they suddenly realise the importance of sleep. Now, having been an ex-raver, we used to come out of the clubs at 8 o'clock, go to an after-hours club till midday, and then go back to somebody's house. No wonder my hormones are all over the place. So, God, we did that for years. Never mind, no regrets. So yeah, sleep, super important. So yeah, he's going to go away and address that. What else? Well, it was a bit of a chunky monkey. So he was aware that his diet needed attention, but he hadn't addressed it. So we all know our diet needs attention. You know, there are aspects of your diet that you can improve. I need to improve my diet. I'm actually going to start counting calories. No, I might. I don't know. I don't think I am. I don't have the discipline to do that. But if somebody could do that for me, that'd be lovely. Kill me now. Yeah. So he was carbohydrate dominant. Now, to optimize testosterone, we spoke about this last time. Put very broadly, you want to have a low carb, high fat diet. Cholesterol, evil cholesterol. It's not evil. Cholesterol converts to pregnenolone, which cascades down to cortisol, aldosterone, and testosterone. So you want a high fat diet. Fats are bad. Fats aren't bad. No, not in the right proportion. And unfortunately, we have a propensity to turn to carbohydrates, and we're all fat. I wonder why. Too many carbs. Obviously, an oversimplification. So, yeah, there was some work that could be done there. So it wasn't obviously just a matter of pregnenolone to, cascading down. It's actually the fact that his increased propensity to aromatization comes in part from having a bad diet, which causes mild liver dysfunction and increased adiposity, so an increase in fat. So, lose weight, low carb, high fat. So we stuck him on the InBody 770 machine, and yes, we gave him his basal metabolic rate, we gave him some targets, and he's going to go and work on them. Now he has something to focus on, which is reassuring. So, lose weight, more exercise, but you need goals. You need goals. We need somebody to set goals for us sometimes, because hurdles can appear too big. So achievable, reachable goals. We all need goals in our life. It doesn't matter what aspect of life you're talking about. So I've suggested that he obviously goes on a low carb, high fat. I've also suggested intermittent fasting, 16/8, because I quite like that. But it is not one size fits all, as we discussed before. So I didn't lecture him on, So yeah, diet was another thing. So increasing his propensity to aromatization. Booze, yeah, not a heavy drinker, but a moderate drinker. What's heavy? Bottle of whiskey. No, he was drinking a little bit too much. Should you give up all your vices? Hell no. But if those vices are having a negative health consequence on your health, then you should at least weigh up the pros and cons, benefit, risks before making a judgment on what you should do. And the obvious thing is, do you enjoy booze that much? If the answer is yes, then okay, keep drinking and keep aromatizing, and then go on TRT, because that's going to be the only thing that's actually going to sort you out. But should you do that? That's a decision for you to make alongside your potentially prescribing doctor. But you should really try and do everything you can to minimize the drugs that you're taking, and be as natural as possible, because natural is best, okay? So there were a few things. There was the sleep, there was the diet, weight loss, and alcohol. So we decided, that TRT was not in his best interest. Oh, I forgot something. Yeah. He wanted to retain fertility. So I've recommended that he goes to a fertility specialist and discusses the option of HCG monotherapy or clomiphene monotherapy. And then come and see me in 3 months' time to reassess the situation. He'd come all the way from Leicestershire. Was he angry about not being prescribed TRT? Well, the answer was no. He seemed very content because we had a proper discussion. We had a 90-minute consultation, which I only charged him for 60, because we didn't give him TRT. But we discussed everything. We discussed the pros, the cons, the risks, the benefits, and we decided jointly that it wasn't the best option for him at this time. So I didn't shut the door, but I said I would do this. So, I think it's important, just because you have the symptoms, just because you have the diagnostic tests, there needs to be more. Because this guy, if he'd gone to somebody else, would have been prescribed testosterone replacement therapy, and it wouldn't have been in his best interests. We cannot be our own worst enemies. Best enemies, that sounds fun. The reality is you need somebody to be objective. So private practice has allowed me to practice medicine in the way that I want to practice it. So that is in the best way. I want to act in the best interest of my patients. So I don't want to be restricted by NHS protocols and NHS medications. I want to offer the best. So I believe that we do offer the best, and we will continue to strive to offer the best. So was he pissed? No, he wasn't pissed. No, he was actually really happy. And he left saying, I'll see you in 3 months. So he travelled all the way down from Leicester to talk to a specialist, to talk to somebody that would act in his best interests, not to get testosterone replacement therapy. We often have this situation where somebody will come and they've followed due process. They've emailed a history. We've had a chat on the phone. They've had diagnostic blood tests, and we don't decide to start TRT. Are they ever irritated? And the answer is always no. Another guy today, again, this was March 2018, and I advised young guy, and I advised him to go and address his lifestyle. So stop partying, reduce stress, look at sleep, so do all the right things. And again, was he irritated? No, he said that he'd been following the group for the last year. He'd done all the things that I'd recommended. He'd seen some improvements, but he hadn't seen the improvements that he'd wanted. So again, he'd come from miles away. I think it was Leicestershire as well. I think 2 guys from Leicestershire. I think so. And so yeah, it's like we've done the diagnostic workup again. Again, we've had a nice, frank discussion, pros and cons, and he's happy to take my advice. He does not want to commit to testosterone replacement therapy unless it's in his best interests. So you can't overemphasize the importance of not only bloods, a brief history, a 5-minute conversation. That is not enough to safely prescribe testosterone replacement therapy. My new patient consultations are 60 minutes if you've not been through this process. They are 90 minutes to go through everything, decide if it's in the best interest, follow due process, and then go through injection technique and decide on protocols, etc. I take time with my guys because I need to be confident that what I'm doing is in the best interest of the patient. The patient also needs to know that I'm acting in their best interests. So a cursory 5-minute conversation and then coming up with 125 of Sustain every 5 days, that is not acting in somebody's best interests. We are not shopping. This is a doctor-patient relationship. This is a relationship that we will be helping grow over the... That's probably the wrong phrase, grow. We'll be together for the next 20 years before I retire. And then another guy said to me, what's going to happen when you retire? Well, don't worry, because the model is strong enough to take forwards and grow. So testosterone replacement therapy is going to be huge. Okay, but testosterone replacement therapy should only be prescribed to people that need it. So we are growing. We are going to grow. We're growing exponentially, and we are taking on more doctors, more nurse practitioners, and our model will be not only gold standard, it will be the standard model, but we'll always stay ahead of the competition, because unlike the competition, we are not motivated purely by profit. Obviously we want to make a living, but we're not motivated by profit. We will always work in the best interest of the patient, and we will always be looking at ways of improving not the service that we offer you, because that makes it sound like a consumer relationship. We are going to try and optimize every single aspect of your health that we can, to make sure that you realize and appreciate and experience the actual benefits of normal testosterone levels. So we will address the lifestyle, nutrition and exercise, so that we do offer a complete package. So watch this space in regards to those avenues. But yeah, testosterone replacement therapy. Only use it if you need it.